This is video podcast 20 from learningradiology.com. Dislocations of the hip. Hello, I'm William Herring from Albert Einstein Medical Center in Philadelphia. In podcast 19, we discussed dislocations of the shoulder. In this podcast, we're going to discuss posterior, anterior, and central dislocations of the hip. In general, hip dislocations comprise only about 5% of all dislocations. They are usually the result of higher energy trauma, for example, motor vehicle collisions. They frequently occur in younger individuals, and two of the more common complications include avascular necrosis of the femoral head and sciatic nerve injuries. Posterior hip dislocations are the most common. The mechanism is a force directed against a flex and adducted knee of an unrestrained occupant of a motor vehicle collision, usually, and they can be associated with fractures of the posterior rim of the acetabulum and fractures of the femoral head. Clinically, individuals with posterior hip dislocations will have pain in the hip, the leg will frequently be internally rotated, and there may be a loss of sensation or ability to flex the foot secondary to nerve injury. The imaging findings: the head will shift usually superiorly and laterally to the normal position. There may be a fracture of the posterior rim of the acetabulum, which is the more lateral of the two edges seen on the frontal radiograph, and the head may appear smaller than on the opposite side because the posteriorly dislocated head lies closer to the cassette than does the opposite side, which is not dislocated. This is an example of a posterior hip dislocation. This is an example of a posterior hip dislocation. The white arrow is pointing to the acetabulum. The F marks the femoral head, which lies superior and lateral to the normal acetabulum, a posterior hip dislocation. This is a CT scan of a posterior hip dislocation. You can see that the acetabulum, labeled A, is empty. The femoral head, F, lies posterior to the acetabulum. There is a fracture of the acetabulum, in this case the anterior column. This is a dislocation of a prosthetic hip. The prosthetic femoral head, F, lies superior to the prosthetic acetabulum, labeled A. Dislocations of hip replacements are uncommon when it is the primary replacement. When the hip has been revised, it can occur in about 16% of cases. The dislocations are most often posterior dislocations, and they are usually caused by loosening of the components or by malposition of the components, especially the acetabular portion. Anterior dislocations are uncommon. The mechanism of injury usually is the hip is AB abducted and externally rotated when injured. Clinical findings could include the hip being externally rotated and either flexed or extended. The femoral head can sometimes be palpated outside of the acetabulum, and anterior dislocations can be associated with injuries to the femoral artery or nerve and fractures of the femoral head. The head usually comes to lie inferior and medial to the normal acetabulum. It may overlie the obturator foramen, and anterior dislocations can be associated with fractures, including fractures of the acetabulum, the femoral head, or neck. This is an example of an anterior hip dislocation. You can see that the acetabulum, marked by the white arrow, is empty, and the femoral head, marked by the F, lies inferior and medial to the normal acetabulum. Here is another example of an anterior hip dislocation. Again, you can see that the acetabulum, marked by the white arrow, is empty, and the femoral head lies inferior and slightly medial to the acetabulum, almost overlying the obturator foramen. Central fracture dislocations are the least common hip dislocation. They are usually produced by a force which is directed laterally against an AD adducted femur, such as occurs in a side impact motor vehicle collision, and they can be associated with retroperitoneal bleeds and sciatic nerve injuries in up to 1/4 of the cases. These are serious injuries. Findings include the femoral head driven through the fractured acetabulum, the leg on the affected side may be shortened, and there are fractures of the acetabulum, the femoral neck, and the femoral head. This is an example of a central fracture dislocation of the hip. You can see that the acetabulum has been split and that the femoral head, labeled F, now lies inside the true pelvis. Here is your mini quiz. This is a 27-year-old who was involved in a motor vehicle collision, brought to the emergency department with pain in the hip. Pause your computer or MP3 player to study this radiograph. This is a posterior dislocation of the hip. The acetabulum, labeled A, is empty. The femoral head lies superior and lateral to the acetabulum, the typical location for the femoral head in a posterior dislocation.